Hello, I'm Dr. Jim Metz from the Metz Center here in Columbus. And I want to thank you for viewing this short video on our upcoming course, April 10th and 11th. You might wonder why we are different, why you should come. Well, my answer is always the same. It's for the depth of knowledge. And I'm going to use this sponge as an example. If you squeeze this sponge, there's hardly anything in it, hardly any water. Maybe a drop or two of water will come out of it if I squeeze really hard. Well, when patients start squeezing you hard, or physicians start squeezing you hard, or other professionals start squeezing you hard, you have the knowledge to tell them more than what is superficial. In other words, if I take and I dip this sponge in this water, I fill it up completely, and I bring it out, and they ask you a question, what I want you to do is be able to tell them all kinds of answers. I want you to be able to tell them everything and anything they want to know. And that's the goal of our courses. That's been the goal of this course, and it'll be the goal of the courses coming up in the future, is to give you enough knowledge that you feel comfortable in the medical profession, which you are. We have Dr. Ron Harper speaking on Saturday, and he's from UCLA. He's PhD in the Brain Science Center. And he is going to talk about the MRI studies of people with sleep apnea and ones without, and the differences in the brain. You're going to be amazed by what he says. It's a scary place to go. It's maybe the roots of Alzheimer's. It's maybe the roots of several other things that, as far as hypertension goes. I'm going to let Dr. Harper explain that. That's a big point to have Dr. Ron Harper here. The other thing that I'm really excited about is a study we've been doing here at the Metz Center. We have been keeping close records on our patients for the last year to see what their drop in sleep apnea was and how much we had to protrude them. At the last course, I started to talk about this a little bit. We went into a little bit into depth about the titration and how to adjust in oral appliance. Well, this time we're going to go into great depth because we have a lot of information. Just for an example, we have one patient that had came in, age 51 male, pre-RDI, was 54.0, and his post-RDI was 0.4. And that was with only 5.5 millimeters of protrusion. That's a 99.25% reduction. Now, we can't do that every time. We have another who went from a 45.3 RDI, 65-year-old man, to a 5.2 RDI, and that's with 4.75 protrusion. How about another? Went from a 30.9 to a 0.6. That's a 54-year-old man, and again, it was only 4.75 of protrusion. What I want to be able to do is drop the apnea-hypopnea index, the RDI, to a level where it's not a problem for the patient and not damage the jaw any more than we have to. The classic comorbidity with oral appliances has been movement of teeth. If we stay in the 5 to 7 millimeter range, that really diminishes the problem with tooth movement. And learning how to do that is a little tricky, and we're going to show you in depth how to do that. We're going to talk about the Minolta 300i, patient safety software combination for titration, and how to use it as a screening tool to refer to your physicians. You might ask who else is going to be here. Well, this time it's going to be a little bit different from everything else. Matter of fact, it's going to be greatly different from everything else. We're going to have our 2 days, the Friday and Saturday, and on both days we're going to have an introductory level course that will run alongside the advanced course. But this time it's even a little bit more in depth than that. On the afternoon of Friday, we are going to have a special breakout session on orthodontics. We're going to have Nelson Deers and Jim Blank moderate that. Brian Vence is going to be here, Tom Wilco. Ted Belford is going to talk about his appliance, the Homeoblock, in depth. And You will have time to ask questions of both Dr. Deers and Brian Vence, and there's several other orthodontists that are coming as well. I don't feel comfortable to reveal their names, but they're well-known orthodontists. On the afternoon on Saturday, we're going to have Dr. Brian Vence take over, and in the breakout session in the afternoon, he's going to talk about restorative care and how to work interdisciplinary medicine and how to work interdisciplinary dentistry and medicine with all the other health professionals. He's also going to go through what he calls co-diagnosis, how to get people to accept work by basically having them understand what you're going to do to them. And Brian is really great at doing that. He's going to go through some cases as well, showing you how restorative care and orthodontic care together can improve a patient's airway. On Friday morning, I'm going to speak and talk about the new study. We have an internal medicine physician that's going to give his perspective first off, and then we're going to have Dr. Mickey Harrison do a literature review of the important articles over the past year. I'm also going to have two very interesting speakers. One is Dr. Frank Seaman from the Colorado Springs, and Frank has done a really in-depth training and study of using lip tape. And I know you might think that's a crazy thing to tape your lips at night, but it's done remarkably well for a lot of people. And Frank has kept careful numbers on that, and he's going to present that idea. I climbed Pikes Peak last fall with him, and from all the way from the bottom at 6,000 feet up to 14,000 feet, all he did was talk about lip tape. And I said, Frank, you got to come and talk about this. He knows so much. The other person that I really like is Louise McDonald. A lot of people call her the nose cone lady. She has the company that manufactures nose cones. I kind of blew those off as not being of much value, and I found out just the opposite. Patients can benefit greatly by using nose cones at night to keep the airway open. Remember, the airway starts at the tip of the nose and goes all the way into the lungs. The other person that's going to speak this time is Dr. John Tucker. John Tucker is an amazing practitioner, and he's going to talk on a very different subject. He's going to talk on vertical dimension of occlusion, and he's got some really interesting ideas about the vertical at which we set appliances and at which we set our restorative care. The entire staff will be in the introductory level courses. We will talk about insurance, we'll talk about how to use a pulse oximeter by the patient. We will talk about how the hygienist gets people to understand about sleep apnea and want to go forward and treat it. That's really important. Megan does a great job on that. We're also going to have Chris talk about how to seat an appliance, how to do follow-up care, and how to get people out of trouble if they get into trouble. He's going to spend some time talking about headaches, TMJ, and all the things we do to keep those minimized while we're advancing the appliance. He is going to also go into the titration protocol. Chris and I work very closely together. The dentist and the auxiliary person must both understand what we are trying to do with the advancement of the appliance. It involves using cephalometric films and then how to download and go over the pulse oximetry reports. Todd Bacon, our laboratory technician, will go over the common problems he sees coming into the laboratory from offices. We're going to spend a little time on 3D imaging. I like the 3Shape, and we're going to show the benefits of using 3Shape for impression techniques and how we can decrease the chair time of seat and how we can improve the quality we give to patients. All in all, there's been a lot of improvements in the last 6 months and for sure in the last year. We're going to bring together all the ideas that we've learned from all over and put them together into one tight, compact course where you learn as much as we can cram into 2 days. We'll have a little bit of a cocktail party on the in between Friday and Saturday. It's all free of charge, and we enjoy getting together and talking. And I've learned more at a cocktail party sometimes than I've learned in a lecture. It's always been something that's been important, is to talk to people in a more relaxed environment. So we would welcome you to come. We're going to be at the Embassy Suites. It's a wonderful hotel. They take really good care of us. We have new projection with a 21-foot wide screen with a very high lumen projector. You're going to see great. I mean, it's going to be dazzling clear. And I'm excited about doing that this time. It almost makes it in CinemaScope. So come, join us, and let us know what you think. And a lot of people come back every time. They don't miss one of these, and we'd like to have you be one of our alumni in October. So welcome, come, call and ask a question if you like. I'm available, or Angie's available to answer. Thank you very much.